Good afternoon. We're here at the NMC Specialty Hospital Al Nahara, and we're going to be interviewing Dr. Rent. He is a surgical oncologist, and he's going to tell us a lot of amazing things that we all need to know. First of all, let me tell you that he has over 14 years experience, and he has treated more than 2,500 cancer patients. So I'm very impressed already, doctor, but I definitely want to get to know you more.
Thank you.
Perfect. Doctor, let's get started. Tell us what drives you to be an oncologist surgeon.
So being an oncology surgeon, it's less a profession, more a calling, to be honest with you.
Okay.
When I say that, let's compare surgical oncology to most other fields. So let's take an example of a hernia, for example. You have a hernia, you go to a doctor, the doctor checks you up, he tells you got a hernia, you then undergo surgery for that. Once you're better, you go back home.
Correct.
And your treatment's done there. Oncology does not work that way.
Okay.
The disease is only a very small part of the treatment. We need to take care of the family members. We need to take care of the financial aspects. The person has kids at home, they need to leave them for a prolonged period of time. They need to take time away from work. So we need to look at a lot of these things in oncology.
Correct.
So it's less treating your patients as a patient, it's more like treating your patient as a family member.
Okay.
That's what's important about this field. And you'll get calls at 2 o'clock in the night saying, doctor, I'm not able to sleep right now because you just told me I had cancer yesterday evening. What am I supposed to do? You can't lose your cool at that time. You got to say, okay, listen, you got to leave the bedroom, go sit in the hall, talk to the patient for some time and then come back to sleep. So it is more a calling and less a profession.
Yeah.
So that's what I love about this field.
Very nice.
I have very few patients. I have a lot of family members in hospital. So
That's very nice, and that definitely shows your commitment and how you do it from the heart more than anything. So very nice, doctor. Okay, so now let's talk about what patient first care mean in oncology.
So patient first care means, see, if you look at, say, let's take breast cancer for example. If I see 5 patients who have breast cancer, to the patient, it's one disease. To us, it's 5 different diseases.
Okay.
There are different types of breast cancer. There are different markers which tell you, in patients' terms, we call them the male tumors and the female tumors. So there are a lot of factors which go into play when it comes to treating a tumor. So patient care in cancer is highly personalized. The treatment which works for patient A will absolutely not work for patient B. And what works for patient B will not work for patient C. So there's a completely different spectrum of treatment for each patient from a disease point of view.
Okay.
What's more important is from the patient point of view, which a lot of us do not realize. I'll give an example. You have 2 patients, both of them 70-year-old, both of them come to you with lung cancer. Now for the first patient, you'll start them on immunotherapy, you'll give them all these medications, and the second patient who has exactly the same disease, you will not do anything. Now, a lot of people say, why is the difference in treatment? So the first patient would have had a family member who's recently going to get married, or probably had a daughter who's a grandchild on the way. So they have a lot of things to look forward in life. The second patient, on the other hand, would be someone who said, no, I'm done with life. I've lived for 70 years. I've played with my grandchildren. I really do not want to go through this whole process of chemotherapy and surgery and this and that and all. She's already made up her mind that she's done with a lot of things and she wants to probably go to some ashram somewhere, go to some church somewhere, spend some time, live her last few years in peace. So that's the thing about oncology. It's extremely patient oriented. The drugs work in different ways in different patients. The disease grows in different ways in different patients. But most importantly, the patients respond very differently. Okay. So every patient is treated very differently.
Good. Okay, I like that we're getting more personal into it's just this general, disease that everyone talk about, but you are actually taking us or guiding us into this is a more personalized approach because like you say, how the patient reacts, how the treatment reacts and everything, amazing. So doctor, most of us fear that cancer is inevitable, it's something that it could happen to anyone. But tell us, what can a person do indoor every day in order to lower the risk of developing cancer?
See, when you say cancer is inevitable, I agree cancer has increased significantly over the last few years, but there's a reason for it. You look at 50 years ago, let's look at my home country, look at India. The life expectancy back then was 35-40. Okay. A lot of people did die of malaria. A lot of people died of tuberculosis. There were so many. Diarrhea was deadly in some patients. Now all these diseases are curable. So the patients who died of those diseases are now getting cured and living longer and longer and longer and longer lives. Now they're living up to the age of 60 and 70. The current life expectancy back home is beyond 70. So that's the reason why at that age lifestyle diseases tend to kick in. You have diabetes, you have heart diseases, and you have cancer. And of course, to some extent, kidney diseases. You have these lifestyle diseases which are now kicking in at the age of 70. So that's the reason why you have an increase in the incidence of cancer.
Okay.
It's not that if you compare a 40-year-old from today and a 40-year-old from 50 years ago, the incidence is the same. It's because we're having a much older population now that you're having an increase in the disease.
Okay.
The second important thing is information about the disease. Back then, there was no Facebook, there was no WhatsApp, there were no podcasts. So people really did not know what cancer is.
They didn't know much about it, yeah.
Today, everybody knows about cancer.
Okay.
So people are getting evaluated. What was earlier a leukemia would have been diagnosed as a malaria or tuberculosis is now being diagnosed as leukemia.
Okay.
So people are picking up the diseases, people are treating the diseases, and that's why you're seeing an increased incidence. But you don't have to panic. Live a healthy lifestyle. Everything in moderation.
Okay.
Everything in moderation. You want to one day go and have a packet of chips, you can have it. You want to have a drink, you can have it.
Yeah.
But in moderation.
Okay.
Moderation is the key to preventing cancer.
I agree. But what are key factors that people should definitely avoid and stop doing in order to lower the risk even more?
I would say 3 things.
Tell us.
Tobacco, tobacco, and tobacco.
Yes.
So this is one cause of cancer which really you don't really benefit anything. I mean, you're seeing vaping in kids in school these days. You're seeing kids age 7 in 7th, 8th, 9th standards vaping, their parents smoking in front of them. You don't really get any benefit out of these out of cigarettes. I mean, what are you gaining out of the whole thing? And it's not just one. It's not just one cancer. It's not 2. It is 18 different cancers in the body. It is cardiac diseases, it is renal diseases, kidney diseases. You're talking about blocking of the blood vessels in the legs, and I've seen 40-year-olds losing their limbs. So if you could make one change in your life, it would be stop tobacco.
In any shape, way, or form,
Any
right?
shape,
Like you
size, or
mentioned the
form,
vapes because people don't realize, there's tobacco in them as well. So that's definitely something that okay, that's good to know. And what do you say, doctor, is the most common myth when it comes to cancer?
Okay, that's a difficult one.
Okay, tell me.
So the reason I'm saying it's a difficult one is myths keep popping up every now and then.
That's right.
Yeah. What worries me is, see, you have AI right now, which is on everybody's phone. You have ChatGPT, you have Perplexity. The information there is good. The information there is authentic. Okay. In fact, we also do refer to it once in a way too. And the good thing about these AI is our patient comes in pre-informed. So it makes my life a lot easier because I just need to build on what they already know. What really upsets us is not AI, it's the other one, it's IA, what I call Instagram Academy.
Yes.
Instagram Academy is you have people going on Instagram, reading posts there and believing it's the gospel truth.
Unfortunately.
And then you open the comment section below and everyone's saying, thank you for telling me this, thank you for telling me this, I've just shared this with my relatives, I've just enforced this in my kid's life. So people are making drastic changes in their family, in their kids' lives, in their parents' lives, in their friends and families' lives, which is really, really, really detrimental to the way things go. At one point of time, there was this thing that do not consume milk. Milk causes cancer. And I had, at every talk that I gave, I had people asking me like, can I have milk? Can I have milk? Can I have sugar? I mean, sugar in moderation is good.
Yeah.
Another example is sour soup. I don't know if it's very popular here, but back home, I used to have cancer patients who used to refuse treatment, go back home and sit and have sour soup for breakfast, lunch and dinner, saying that, no, I read on Instagram that it cures cancer.
Yeah.
This is what upset is.
Yeah, and there was going back to what you're saying, and the point is, I mean, it's great that people are getting informed, but at the same time, like you said, there's a lot of misinformation there, especially in social media like Instagram. And there was a big article, a local article in a big newspaper saying that people are now refusing treatment cancer because instead they want to follow the diet that this person posted on TikTok or Instagram that says it cures cancer. So can you please send a message saying I mean, it's good that you're eating healthy and everything like that, but do not stop seeing a doctor. Please tell the patients.
So what I would suggest is, if you really want to know about cancer, I do agree ChatGPT and Perplexity gives you very authentic information. But there is a website called PubMed, that's PUBMED. It is what we as doctors refer to because that gives you cited information. When I say cited information, it is information that is authenticized. It is information that has been reviewed by a bunch of doctors who are specialized in this field, and only then it goes on there. So PubMed is the way to go, or to some extent you could use one of these AIs because I found them to be quite authentic.
Okay.
There is misinformation everywhere, but the level of misinformation is a lot less here. But when it comes to PubMed, we're dealing with very, very authentic information.
Okay, good to know, doctor. Perfect. Okay, what would be one piece of advice that would you give to yourself when you were 25 or younger regarding cancer prevention?
I would
going back?
say, going back to when I was 25, it was
You're so young, doctor. It feels like that was yesterday.
that was a long time. That was 20 years ago.
Oh my God, doctor. Okay, so what piece of advice do you give, let's say, to the young generation?
So I would say when you're 25 years old, cancer shouldn't be the first thing on your mind.
Correct.
Concentrate on being healthy. Concentrate on sports. Concentrate on keeping your heart and your bones strong.
Amazing.
Because if you start thinking of cancer at that age, you're not going to worry about the things which are more important. Your bone strength and your heart are a lot more important at that age. Get in your exercise. Get in a good diet. Cut down on things. Absolutely no smoking. Limit your alcohol intake.
Okay.
I'm not saying stop alcohol because then no one's going to listen to me, but limit your alcohol intake.
Okay.
But absolutely no tobacco. And build on healthy habits, because the healthy habits you build on when you're 15, 16, 20, 25 is what can be later on worked on further when you're 40, 45.
I agree.
Because if you don't exercise at that age, when you get to 45 and you start going to the gym, you're going to have a lot of problems.
Yeah, it's going to be difficult to adapt to that as well.
Yes.
Okay, so let's go into this one. Like you say, at that age, people should have been thinking about cancer. But if there's cancer in the family, when do you think is the time where people should start maybe screening for cancer?
So the ideal cutoff for cancer screening is about the age of 40.
Okay.
40 is when we started.
Okay, good to know.
But if you have multiple relatives, having one relative who had cancer doesn't really increase your risk.
Okay.
To put things in a medical perspective, familial cancers is only about 5%.
Oh, good to know.
95% of them is everything else.
Okay.
So if you have a family or multiple family members who have had cancer, and if they are related to each other, what I mean by that is if your father and mother both had cancer, your risk is not higher. But if your father and your father's brother, or your mother and your mother's brother, if you have multiple relatives who are related to each other who had cancer and had similar cancers, then yes, you need to start screening at an age younger than when they developed that cancer.
Okay.
So that's what's important.
That's a very, very good important insight. Perfect. Amazing, doctor. Okay, as a surgeon, how do you feel about the new technology advances when it comes to oncology surgery, and how does it improve patient care?
So technology has helped us a lot. I will not deny that. We have advances in laparoscopic surgery, we have robotic surgery, which is really building on our forte. But what's really making a difference to us is the recent advances in medical oncology.
Okay.
So like I have my colleague Tanraj, who I work with, phenomenal medical oncologist. So the kind of arsenal he has right now with these things called as immunotherapy and targeted therapy, the kind of work that is in treating cancer patients, I mean, life has become a lot more easier for me.
Perfect.
To put things in perspective, we give chemotherapy either before or after surgery.
Okay.
Okay, there are different indications for both. So when we give it before surgery, we have something called as a pathological complete response. Again, and let me not get into medical terms, but we sometimes notice that the tumor completely shrinks and even disappears. I'm seeing that happen more and more and more these days.
Okay.
Which, what I'm getting at is we're looking at a much higher cure rate than what we used to look at earlier. So I tell a lot of my patients, they say my mother died of cancer, my father died of cancer. I said that was 40 years ago. The treatment was not that great back then. Right now I got a team member who's going to take very good care of you. your life is going to be very good after this.
So can I ask you, man, can I say this, that do you feel here at the NMC, a specialty hospital, you guys have the personnel, the capacity, the technology to get good treatments and have better outcomes when it comes to treating cancer?
Yeah, we have what it takes to. I mean, we could be one of the world leaders pretty soon when it comes to cancer care. That's the kind of, our management is very, very supportive. Anything we ask for, we get it overlapped. So, I mean, there's nothing more I could ask for. I wouldn't be happier anywhere else.
That's amazing. And to be honest with you, I mean, I have got to know some of you and I've been very impressed by that level of care that you guys provide to your patients. So like that's very, very good, doctor. Okay, and something a little bit tough for you, I think, as a doctor. How do you manage that, how do you manage giving the message instead of being like keeping the patient in the realistic and obviously what they want and what they hope for? How do you manage that when it comes to talking to the patient?
Managing expectations, yes.
Yeah.
It's a bit of a tough cookie to handle, but we take it a step at a time.
Yeah.
See, what's important is, to be honest with you, the first visit with a cancer patient is generally taking where the patient has good news. It sounds very morbid when I say this, but a patient, before he enters my OPD, before he comes in and sits in front of me, assume she's going to die in the next 6 months. He comes, he sits there because he's not really educated on this thing. He's again searched on Instagram and things like that. And suddenly I start giving them information saying that, listen, your tumor is stage 1, your tumor is stage 2. 95% of the patients are cured, 90% of the patients are cured. And suddenly their perspective tends to change. They've walked in tears and they walked out smiling. I've seen this happen very, very often. It's surprising to hear this, but when you actually see a patient coming in saying, doctor, I'm going to die, and you say, no, my friend, you're going to live. You're going to be there for your children's wedding. You're going to see your grandchildren. I mean, that puts a whole different perspective in life for them. They start fighting the disease a lot stronger. They get the mental ability to cope with the treatment and to fight the disease. And a lot of them do come winning at the other end. And that's what's important.
Yeah. And thank you, doctor. I think that comes a lot from you. Like you say, you care for your patients. The person comes with this concern, and the way you manage it, it can change the perspective of the person. So, perfect. Okay, doctor, we want to get to know you better.
Okay.
So we're going to go for fire round questions. You got 60 seconds to answer these questions.
Okay.
If there's a question that you don't feel like, you say pass, and we move on to the next question. Are you ready?
Done.
Doctor, how many patients have you treated for cancer cancer so far?
3,200 so far.
Oh, wow. What is the top cancer sign people ignore?
I would say weight loss. Basically, any symptom you have for more than 6 weeks, get it checked. Cough,
Okay.
bleeding, anything more than 6 weeks, get it checked.
Good point. One habit that people should quit today.
Smoking.
What is the best screening age for breast cancer?
I would say 40 is ideal unless you have a very, very strong family history.
What do you see in the future of cancer treatment?
Oh, the advances are mind-blowing. I wouldn't say what's going to happen in the next 3 years. Forget about the next 10. It's very difficult to comment, but things are going to change drastically, yes.
What is your mantra for patients?
Stay healthy, stay fit. Your family is very, very important when it comes to cancer care.
I love it. And what is a message that you keep for people who are afraid of cancer surgery? Like, to remove cancer.
It's not as bad as it seems.
Okay.
It's honestly not as bad as it seems. I put a lot of them in touch with other patients who have gone through the process, and they seem quite comfortable with the whole process. It's not as bad as it seems. Like, for example, breast cancer and thyroid cancers is a daycare procedure. You come in the morning, you're off in the afternoon, you're back home in the evening. So it's not something you need to be scared of.
Dream destination to relax?
Goa.
Very good. What is your go-to comfort food after a long day at work?
Chicken biryani, there's no doubt on that.
Do you have a podcast or book recommendation?
Not really.
Okay.
That would be a little difficult.
Are you a reader, or you like more podcasts, or you TV?
TV series.
TV
I'm a
series. Tell
guy.
us one. Which is the last one you watched?
I'm watching Rookie right now, which is a police show.
Okay.
Pretty nice one.
Okay, good to know. I'll check it out. And tea or coffee?
Coffee, pure coffee.
Yes.
Yeah, I
How
love
many
my
coffees a day, doctor?
4 to 6 would be my.
Oh, wow. Okay, perfect. Doctor, what a pleasure getting to know you. I
Thank
think you
you.
have given me, and I think you have given the people who are watching and listening to this, the comfort to knowing that yes, cancer exists. Yes, cancer exists, but there's a lot of things you can do about it. And
Yeah.
thankfully now you have great doctors like you have the technology, and you have amazing hospitals like NMC that, it will take care of us.